Hello, everybody, and welcome back to episode 4 of our Medical Minute podcast, where we've been focusing on prostate cancer. We've taken some baby steps so far. As you might recall, we started out with something as simple as what is cancer, and but we've kind of moved up a little bit from there, talked about early detection and what a patient's options are if indeed they find out that they do have cancer. Today, we're going to focus on what happens if surgery, radiation, or the combination thereof fails, and I'll put that in air quotes for a reason I'll explain in just a minute. Our producer is going to hold us to 10 minutes or less today, so we'll move quickly. 4 or 5 questions, try to keep them to about a minute and a half each. So Jill, as I just mentioned, people often say, and I said this originally, that, surgery failed or radiation failed. Does it really fail, or is there some other reason?
So when you look at surgery and radiation for prostate cancer, what you have to understand is it is a very localized treatment. It is not something that is broad. It's focal to just that area. And so, and as amazing as our modern technology is with the scans that we have and everything, it still cannot pick up cancer down to a single cell level. And so in instances where a man has had surgery or radiation or a combination of both, and he later goes on to develop metastatic disease, usually what has happened is there's been one little cell that's gone a little haywire and got loose and moved on to some other part of the body.
Yep, indeed. Okay, so let's say, for example, in our hypothetical case that, we'll act like it's hypothetical, that's what's happened. So what do we do next?
So once a patient has recurrent disease and they've been confirmed to have metastatic disease, now we start looking at other treatment options in that setting. They're no longer going to just be observation and PSAs after the surgery or radiation. Usually the front line is hormone therapy. And they, depending on the aggressiveness of the disease, they can often use that in combination with some of the oral medications as well. Or depending on the patient, they can do just the hormone blockade itself. With prostate cancer, there are so many treatment options once it has become metastatic that it really is tailored to the specifics of the patient.
Got it. So what exactly is hormone therapy? What's the goal with hormone therapy? What does it do?
So with prostate cancer, testosterone is the male hormone that feeds prostate cancer. It's kind of the driver. It's what causes and enables the cancer to grow. And so what the hormone therapies do is they block the production of that hormone so that you essentially starve the cancer. Okay. Yeah, it's funny. And so I'm about 5 years in on this, and it's funny. I'm on like a bunch of different discussion lists and things and I literally see guys say like, I'm just going to go off. These side effects are killing me and things like that. I don't know. Maybe everybody has different tolerances for different things, but I take the approach that it's so much better than death. But I know that just for people that might be wondering, I think pretty typical side effects are you might feel a little tired. It's pretty commonplace, I think, to put on weight. Your appetite can be affected. But I think, you tell me if I'm wrong, I think one of the main things is that testosterone plays a pretty big role in metabolism as well. I don't think you metabolize things quite as well, and you get tired. You don't really feel like being as active. So it's kind of prescription for weight gain. So far for me, that's the worst thing. But other than that, I feel great. I feel fine. So I don't think guys should be really overly worried about that. Would you agree? I 100% agree. I have a few patients that, were avid golfers, and they would come in complaining because their drive wasn't as far as it used to be. Your athletes who notice a difference in their strength or endurance. But again, you balance, your prostate cancer is well controlled. You're still out on the golf course or you're still on the basketball court. However, you're not facing death imminently. Right.
Exactly. Okay. So we can switch up medications that are given sometimes in combination with hormone therapy. Kind of try a bunch of different things. Hormone therapy buys a certain amount of time, and you can do that for a while. What other things? Tell me real quick, why don't chemo is not really common early on, but it is becoming more common as an adjuvant therapy. So can you explain what that is, and then just what might be down the road for treatments kind of post-hormone therapy?
So the term adjuvant therapy, essentially what that means is once the cancer has been completely removed and you have done scans and the scans are showing that you don't have any evidence of disease in your body, what the adjuvant treatment is that it's a treatment that is an insurance policy. It's guaranteeing or offering additional treatment to potentially catch any of those little cells that went rogue and could possibly be causing a problem. They usually set a duration. It's usually for, 4 or 6 months, sometimes a year, and depending on the case. But it just gives additional assurance for better disease control long term.
Gotcha.
As far as chemotherapy in the treatment of prostate cancer, it is used, but chemotherapy comes with its own list of side effects and complications. And so they really do try to use some of the more hormone-based therapies prior to using chemotherapy. The other piece too, and I'd referred to a variety of prostate cancer that could be described as your couch potato variety. Right. That's more of a slow growing cancer, and chemotherapy works in the setting, and it works better in the setting where cancer is more rapidly dividing.
Oh, interesting.
And so they really do try to use it when it's appropriate.
Okay, yeah, that makes total sense. From what you've read, do you think there's promise for? I know initially it wasn't quite as well regarded for prostate cancer, but do you think there's promise for immunotherapy down the road?
There's definitely some ongoing studies that are showing some promise in regards to immunotherapy, and there's other hormone-related cancers that they're seeing benefit in as well. So it's just going to be a matter of time. Sounds
great. All right, so our producer Chris, you can see we're well in under the timeline. Thanks, everybody, for joining episode 4. We'll be back next Wednesday at noon for episode 5, where we'll kind of close out our conversation around prostate cancer and move on to another topic. So thanks, everybody, for joining.